there's always a missing element of touch. We like to examine our patients, we like to test our patient and see and explore the disease further. So there was always a missing factor there. Plus, of course, when you're physically present in front of your patient, they also see there is a factor of body language there, which makes it very easy to.
Dr. Sara Saeed Khurram is the co-founder and chief executive officer of Sehat Kahani. She joins us live from Karachi, Pakistan. Welcome, doctor. Now, what we've seen from COVID is, of course, the devastation it has caused to families, but worldwide, it has also exposed the weaknesses, or you might say illnesses within every country's healthcare system, the structure of them, even in the world's wealthiest countries. So obviously, with the technology we have today, telemedicine is an obvious place to go for help, but what have the challenges been to telemedicine in Pakistan?
And thank you very much. I think the news package really tells our story. But the biggest problem in Pakistan is that we have one doctor for 1,700 people. As we all listened, majority of our medical workforce is made up of female doctors, but unfortunately, a very small number of this workforce actually works. Many of us sit at home and become doctor brides. And additionally, there's a huge male doctor brain drain that takes out 25,000 doctors from the country. So out of 200,000 doctors that we have, only 90% are working. Along with the one doctor for 1,700 people, 85% of these doctors work in urban areas, which mean that 71% of our population who lives in rural areas only gets 15% of actual doctors. Now, when a doctor doesn't go to a village or a low-income community, that space is quickly filled up by a quack or a midwife or a dispenser or anyone who's not qualified to provide consultations. And that is the biggest challenge to healthcare, in my view, that when a patient does not get to see a doctor, they get to see someone else, and that's where the malpractice and negligence begins. And women and children are the brink of this because they are the most neglected area of our community. I think when we started out, the biggest challenge that we faced was that we were bringing telemedicine into a community where a woman coming on a video call is not concerned very mainstream. It's not something that they see in their daily lives. So when we brought this technology to their village, to their community, to their clinic, they thought that they're going to be recorded, the video is going to be uploaded on the internet. And because we're a culturally conservative society, a lot of people were very, very scared of trying an online doctor. They also did not believe that the doctor was real. They thought it was an actor. So we quickly came up with solutions and strategies so that people start trusting the doctor. We found nurses who championed our cause and who made people believe that these are actual doctors. We put their degrees and certifications in the clinic. And we saw that once the patients started coming in and showing to the doctor, they saw a noticeable difference in their diseases. There wasn't a quack or a midwife that was over-prescribing them antibiotics or steroids and making their health condition worse. It was an actual doctor who was listening to them, giving them time, and that is where it changed the story for us. So in the beginning when we started, we didn't used to get even 10 patients a month, and now our clinics do around 100,000 patients a month. And we also launched a mobile application that sees hundreds of patients every day, where patients come in and connect to a doctor themselves, and in a few minutes, they're connected to an online doctor. So the story of telemedicine has really changed in Pakistan, but we being the first people to lead this through, when the COVID-19 pandemic came, I think we were well settled to handle the problem. And that's what gave us the edge in providing this solution and really adapting to the COVID-19 problem in Pakistan and quickly coming up with solutions that can help a lot of people in a very difficult time.
So what about those women that we just heard about who are educated in medicine? They stopped working or they chose not to work to raise their families. Has COVID-19 mobilized some of them to say, well, I want to contribute to the effort? And is your project working to try to get some of them into the field?
So we started in 2017 until 2019 when COVID, in 2019-20 when COVID hit Pakistan, we had around 1,500 doctors in the network. And as COVID hit in Pakistan, we got the opportunity to work with the federal government, the provincial government, and a lot of other stakeholders providing a solution to an expanded market. Everyone wanted to talk to online doctors suddenly, and we got to rapidly expand our network. And we went from 1,500 to 5,000 doctors in 6 months. What I've seen with these female doctors is all of them want to work. They suffer with low self-esteem. They suffer with mental health issues. They're not able to do what they've studied for 16, 17 years. So I think what we did was we just gave them an opportunity to come back to the workforce, working at a time where they felt comfortable with their children, being in their home in a cultural environment that was suitable to them. I'll give you a small example. We had a doctor on the platform who was 9 months pregnant. She had her daughter, and within 12 hours, she was back on the platform because she didn't want to leave her patients behind. I think this is the motivation that we've seen from our female doctors. We just had another doctor whose child was delivered at 7 months. She was in the hospital. Her child was in the NICU. And while her child was in NICU and she came back home, she started doing consultations again because she knew that this is the purpose of her life that she needs to fulfill for. And I think the real validation comes in with people who they talk to suffering from general mental specialist conditions. They generally talk to people who don't see a doctor, who don't get the opportunity to see a specialist or a mental wellness specialist. So when they start talking to the patient, they get really emotionally connected of being able to provide them this opportunity to get quality health care.
Dr. Khurram, such inspiring work. Keep it up, and thank you for joining us.